this is her happy place. Healthcare worker Edwardine Maris Mondina-Baladad finds comfort in plants to manage her burnout from work.
I'm doing gardening just, I don't know, just to feel good, I guess. And I feel happy when I garden.
Edwardine is working as a full-time clinical administrator at the Hanem Fertility Center in Toronto.
I love my job, even though it's like that. But I feel like I'm achieving something when I'm helping others.
She says the COVID-19 pandemic has changed the way they work in the office.
First off, the workload was 2 times than before. And I feel like we're all overwhelmed with the process of switching to online for everything.
During the early stages of the pandemic, the center let go of some employees, but this year it hired more staff. More employees meant that they need to physically distance themselves, follow other health protocols, or adapt to the work-from-home setup.
But now that there's expanding and more patients are coming in, and a lot of staffs are in the clinic, we can't be what we used to, that there's a lot of staff. So we're still like doing 2 meters apart. We're apart from each other. We're not together in one place.
Sometimes she brings her work home, and this increases burnout.
I feel like it was okay because it's like they're gonna pay me for that. But then again, I just have to give a small time to finish the work. And yeah, it's okay, I guess. But sometimes it's exhausting because you're bringing work from home.
When she feels exhausted or burned out from work, she tends to her plants. She started this during the pandemic.
I have fiddle leaf fig trees. I have the monsteras. I have some orchids. I have the jade plants. I have the peace lilies and alocasia polys and the rest. Some of them are in the living room. Some are near the stairs because some of my plants doesn't need to have a direct sunlight. Some plants need direct sunlight. They need the place where there's moist and stuff like that.
Edwardine lives with her younger sister, Lorraine. The younger Mondina says she supports how her sister is coping with burnout.
I think it's a good way to use gardening for her to distress because it gives her time to not to think about the stressors, and being surrounded with plants gives her fresh air.
Although all of Edwardine's plants are grown indoors, she says she still has to pay close attention to them since it's her first time gardening.
I need to read more about them because it's just my first time growing plants. So it hurts my feelings when they die or the leaf falls or whatever. But then again, I'm still learning.
Lorraine says whenever she notices that her sister is irritable due to burnout, she tries to make her happy.
I try my best to be patient with her, and sometimes when she gets home and doesn't have an appetite, she doesn't eat. And when she gets hungry later at night, I try to prepare food for her.
Stacey Levine, a behavior therapist in Toronto, says there are a lot of factors that increase the way in which someone experiences burnout.
Our lower and our fatigue levels get a lot higher. So it creates a certain burnout, and we start to feel it both mentally and physically, and even emotionally. It can impact our ability to regulate and just sort of function to our best capacity day in and day out.
The pandemic has affected everyone in different ways, but has especially led to burnout amongst healthcare workers who serve as frontliners. A study published by the Ontario COVID-19 Science Advisory Table on October 7th of this year revealed a higher prevalence of severe burnout among healthcare professionals in Canada. This year's study showed that more than 60% of healthcare workers experienced severe burnout, an increase from last year's study, where burnout levels were at 30 to 40%. Levine says that there are ways to cope with burnout, and these don't have to be grand.
offering to take someone for a coffee or just go for a walk, or even helping in the home to some capacity that might make that person's life a little bit easier if they've noticed there's a higher level of exhaustion and stress, which has led to the burnout.
If a simple conversation over a cup of coffee is not enough, Levine says there is treatment for burnout, but it requires commitment.
Behaviorally, they say that to reset a certain pattern or routine takes between 21 and 28 days. And I think that it involves commitment. So if it's recognizing like, hey, I'm not functioning very good right now, I'm really feeling burnout, it's starting small and building on some of those changes that are going to have a positive impact in your life.
As for Edwardine, she has found her happy place and burnout antidote in the simple act of home gardening, a hobby she hopes will help her cope with many of life's challenges for years to come. For Say News, Allison Stewart.